Hello, I'd like to introduce Tammy Koonce. She is a communicable disease nurse consultant at the Guilford County Department of Health and Human Services. Welcome, Tammy. I'm glad you're here with us.
Thank you for having me.
I would like for you to share with our students how you came to be a communicable disease nurse consultant.
Well, with the health department, I started working with them back in a few years ago. It's been about 4 years now. And I initially started as a communicable disease specialist, nurse specialist. And how I came to be a nurse specialist, I have a background in medical surgical nursing, as well as legal nurse consulting. And I've done some congregational nursing. So all of my experience taken into account, I was hired as a specialist. And we had a position open for a nurse consultant. And so I applied, and I'm the communicable disease nurse consultant. And basically my job changed slightly, meaning that now I take lead in receiving reportable disease notifications for the health department now.
So did you have special training or anything once you were hired by the health department?
Yes, I had to take the communicable disease nurse consultant, the test. I had to take the course and pass the test for communicable disease nursing. And I also had to take an infection prevention course.
And were these courses long, short, continuing education? What were they like?
They were pretty much continuing education courses.
Okay. All right, so what do you do as a communicable disease nurse consultant?
So in North Carolina, there are over 70 reportable diseases that have to be reported to the health department should there be a positive lab report. So our office receives all of those reports for Guilford County. And when we receive those reports, we initiate an investigation to see if the patients actually have those diseases. And we also educate the patients about the diseases. We educate the public as well as consult with healthcare providers about those diseases.
What makes a communicable disease a reportable communicable disease?
If it's on the list of reportable communicable diseases, then it is reportable.
How does a disease get to be on the list?
That's a good question, because there are some diseases that may not be on the list, such as in the case of Zika or Ebola. They weren't on the list several years ago. And the reason why they ended up on the list is because there was an outbreak of those diseases. They were discovered in an outbreak. And there was efforts done to determine what the disease was, where did it come from, who are the people at risk for getting it. So as a result of those investigations, those diseases ended up being on the reportable list.
Great, that's great information. Okay, so you take the lead with reporting and the community. Can you tell us about the team and what you do with facilitating communication?
So in the health department, there are other professionals who are on a team called an epidemiology team. We call it our EPI team. And we consult together about diseases, in particular outbreaks that might be happening, or potential outbreaks, or new diseases that are on the horizon. So I take the lead in conducting the meetings for our group, and we meet quarterly. And we also communicate with one another in between time. We might call an emergency meeting to discuss something that might be happening. Whenever there's an investigation that's going on, the EPI team is always notified.
Okay. With your team, do you guys do anything with the influenza that we hear so much about in the fall and the winter?
So with our team, we discuss numbers, flu numbers, in particular flu death numbers, because the flu is not reportable, but if there's a flu death, that's reportable. So we discuss preventative measures such as vaccinations, hand washing, covering your cough, when you're coughing, what to do when you're sick, things of that nature. That's what we discuss in our meetings and what our efforts are in each of our departments to get the message out.
Okay, and that leads me to my next question. Can you describe your role in primary prevention of communicable diseases?
So we educate the public as well as our patients about how to prevent spreading disease or getting disease. So we educate about hand washing, appropriate cooking temperatures, storage of food, anything that could prevent transmitting a disease or getting a disease. We also discuss using condoms, during sexual protection, things of that nature to help prevent getting a disease.
Okay. And then what do you do with secondary prevention?
So say the person has the disease or has been exposed, then we talk to them about how to not spread the disease to others.
And you follow up to confirm diseases with laboratory reports?
Yes, so if we receive a positive laboratory report, as like in the case of hepatitis B. If someone discovers that they have hepatitis B, they've been tested for it, and they test positive, this is the first time they've discovered that they've had it, then we'll talk to them about what to do to protect other people from getting it.
Okay. All right. And in general, are there a lot of screening measures related around communicable diseases?
Screening typically is done on a symptom basis. So when you go to your primary care doctor, they typically may not test for certain diseases. But say for instance, if they draw your labs and your labs are not right, your electrolytes are not right, your liver enzymes are elevated for some reason, they will investigate further and do a test for communicable disease.
Okay, great. So you get this notification and you've talked to the labs and there are labs there. Can you tell me a little bit about what the investigation process is for communicable disease where you want to prevent an outbreak?
So I will contact the healthcare provider that did the testing and talk with them about symptoms the patient may have had presented with. I'll ask for medical records, documentation regarding their visit, and then I'll also talk with the patient to see what the patient says, what kind of symptoms they had, what kind of exposures they may have had. Did they travel somewhere? Is somebody else that they know of sick as well? So our investigation will include the doctor, the patient, and it could possibly be anybody else that has some of the similar symptoms.
Okay. And in your investigation, what are you trying to discover?
I'm trying to find the source of the person's illness.
Okay.
To see if there's a source.
Can you talk to us about maybe a vector-borne type of communicable disease and what that would look like from your department?
So we receive typically a lab report for vector-borne disease, and we will ask for records from the physician to see if the patient has symptoms of a vector-borne illness. And we will contact the patient as well, if necessary, to see if they've actually had any exposure to any vectors, like a tick or a mosquito. And we'll ask them if they've traveled anywhere, if there's anybody else that's sick as well. Did they have any did they do any prevention against any type of ticks or mosquitoes, such as using bug spray, or did they use any type of cream or anything to help prevent exposure to any vectors? And then we'll ask a specific question, if it's about Lyme disease, did you have the bullseye rash? Typically, most people that get Lyme disease will have a bullseye rash, but there's a certain percentage that will not. And then we also look at the type of test that's done. And according to the algorithm, if the type of test is done and they have the symptoms, then they have the disease. But if the type of test that's on the algorithm was not done, but they have the symptoms, they might have the disease, so they would be a probable case. So our investigation will help us determine whether or not the patient meets the case definition that's given to us by the CDC. Every reportable disease has a case definition that we use to help determine whether or not, for surveillance purposes, that patient meets the case definition for that particular disease.
Can you talk to us maybe about an airborne disease?
So with airborne, like for instance, measles can become airborne. So in situations of the measles, you really want to know if the patient that you're with, do they have the measles or not? Because you will have to initiate airborne precautions. It will be very important for you to understand the types of precautions that are needed in the healthcare setting. So, understanding the symptoms of measles or any other airborne disease, tuberculosis, is important, and knowing what to do if you are taking care of a patient that potentially has an airborne disease.
Have you ever had a case where you had a disease and then the health department had to work in authority of some case, maybe quarantine people or something similar that you could tell us about?
Years before.
Generally.
Oh yeah, years before I started working with the health department, there were some cases of, I think, the measles.
Okay.
That were where the health department did have to quarantine some people, provide vaccinations for people that weren't vaccinated, or provide prophylaxis vaccinations for people who weren't prophylaxed, who hadn't been vaccinated prior to potential exposure. There was also a hepatitis A outbreak that took place in Charlotte, and there were some patients in Guilford County who ate at the restaurant where there was an exposure to hepatitis A, and the vaccine was made available to people who thought they may have been exposed. So in situations where there is an outbreak, the state health department will provide vaccines or medications to the local health department to distribute to people that may have been exposed.
Okay, very good. Can you describe the members of your team, of your EPI team?
Sure, they consist of another CD nurse. We have others who work in CD nursing as well. There's two of us, but there are two others that can do CD nursing. We also have nurses that work in tuberculosis, TB nurses, school health nurses, and we also have our health director, our medical director, and our environmental health. We have an epidemiologist that helps us, that reviews numbers with us about other communicable diseases such as sexually transmitted diseases. They also keep track of all of the communicable diseases in Guilford County and help us to identify trends and what we can do to address communicable diseases that are on the increase, such as STDs.
Yeah. So when you discover a trend, do I hear you saying that there's a concentrated effort
Yes.
to do public education? What would a concentrated effort look like?
So concentrated effort would be a public health message to get tested. Another effort would be increased testing, offering tests to those of the clients who come into our health department, talking with other healthcare providers about testing and what to test, what type of test to do. what kind of treatment is needed, our efforts to find contacts to those that may have been exposed to someone who tests positive.
And so do you use community partners often?
Yes, we depend on our community partners because, this is a network of healthcare. We're not operating in an isolated healthcare setting. We depend on our healthcare providers for the healthcare of our county, of our community.
Recently, your department was awarded an award around the healthcare-associated infections. Could you tell us about that?
Sure. The North Carolina State Communicable Disease Branch, Healthcare Associated Infections Department, gave us an award for our efforts in investigating Legionella cases in Guilford County. We experienced a high number of reports of Legionella cases beginning with 2015 up until 2016, the whole year. We noticed that there was an increase of cases, and so we began questioning, why do we have so many positive cases? And we began investigating and found that this was the case nationwide. It was statewide, nationwide. For whatever reason, Legionella is on the rise, and it's a bacteria that's found in our soil and water. And those that are at risk of getting the disease are those that might have other comorbidities, like they may be a smoker or have smoked in the past. They could be immune compromised. And in particular, they could be elderly. They don't necessarily have to be elderly, but they could be elderly is what we found a lot of our cases were. They could have visited a healthcare facility, and so we would have to investigate if it was healthcare associated or not.
So you found connections?
We did find connections in our community. And there was a couple of cases we thought may have been healthcare associated. So our health director, who has authority to initiate surveillance and control measures, had to initiate control measures and surveillance of facilities.
Wow, that's exciting current event work.
Yes,
that you get
it's
to
cutting
do.
edge.
It is cutting edge. Would you speak a little bit about population health, because there's a whole movement and new verbiage around population health and community health, and can you just explain communicable disease from a population health standpoint?
So it's important that if a person knows that they have a communicable disease, they know what to do and what not to do when they are tested positive for disease. So to prevent transmission, we have to educate that person about whatever practice that they have or they're doing to make sure that it's not transmitted to someone else. Meaning that if someone needs to be vaccinated that you are in contact with, find out what that person's status is. Encourage that other person that you're in contact with to find out their status, because some diseases are vaccine preventable. And ultimately, your health can affect a community of people. So it's important that, vaccines be given when they can be given to protect the health of the community. And we live in a society now where that people are traveling from place to place. And, if you travel somewhere today, you could bring back a disease tomorrow. That's just, the world that we live in now. So it's important, like case in point with Zika virus. Zika, with the travel to areas where there's transmission, if a person is pregnant, if a young lady is pregnant and she travels, that puts her at risk of transmitting the virus to her baby. So it's important to know when you're traveling somewhere, what do you need to do before you travel there? Because the places that you travel to may not have a strong healthcare system such as what we have here. And it's important to know preventions before you travel somewhere.
That's great advice. Speaking of advice, we have a lot of new RNs or people who are working as an RN, but as a communicable disease specialist and consultant, can you tell us a couple of things you would like all RNs to remember about communicable disease?
When you have a patient that comes in and they're complaining of symptoms, it's important to ask, have you traveled anywhere? And have you been around anybody that's sick? Because that can give you a clue as to whether or not this is a communicable disease or not.
So do you feel like you are a private investigator agency with a little bit of mystery going on in your life?
I do, because I'm constantly asking questions. What's caused this? Where did it come from? Who else has it? What can we do to prevent it? So it's like CSI for nursing.
If you have inspired someone to want to be in communicable disease nursing, do you have any advice as far as what path they would travel to have the right experience to become one?
I would tell them anywhere you start in nursing is a good place, because what's important is being able to think critically. Your critical thinking skills will help you with surveillance and investigation.
And do you find yourself using the nursing process?
Yes. I'm constantly using the nursing process throughout every case that I work on.
Well, thank you for being with us today, and we appreciate all the information you gave us, Tammy.
You're welcome. Absolutely.
Thank you.